Today, cosmetic surgery gone wrong. It could happen to anyone, and it does.
All right, let me introduce Dr. Lipkin. We've heard your name a couple of times already during the show. Often when patients, when this kind of things happen and there's been mistakes or accidents, some people turn to you in the hopes that you can fix mistakes other doctors have made. Women come in to see you are really devastated emotionally by the scars, the physical and emotional scars left behind by bad cosmetic surgery.
They certainly are. And the emotions range from anger to total devastation. People cry in my office. This is a plastic surgery office. It's supposed to be happy. People are supposed to look better. It's just a matter of economic ability to look, you know, as good as you can look. And people are sitting there. Debbie was in tears. I mean, when she thinks about her nose, she feels like crying.
What can we do about Karen? Because here's this lovely young lady who's so self-conscious about, you know, having any kind of intimate relationships with her boyfriend and exposing her breasts, and she feels so awful about it.
I think Karen has lost faith in doctors after this operation. There's no question something can be done. Slowly, I would go very slowly, small scar revisions, maybe using some silastic gel sheeting, you know, small procedures to regain some confidence in that something can be done, and little by little maybe make it better, not perfect, but better to the point where she doesn't think it's such a deformity anymore.
Karen, would you be prepared to try something like that?
It would take me a lot, but I probably will be.
I mean, when you come in to see a plastic surgeon, you say, I want this nose, the one like Lady Di has. I want, you know, you know, cheeks like Cher. And maybe it just doesn't work on your face. What do you do in situations like that?
Well, I don't even like patients bringing photographs of anybody into my office. What I tell them is basically I try to create something that looks real, so people can't tell you had surgery. You leave the good, you take away the bad, but you make it all match. So it has nothing to do with somebody else's body parts. You're starting out with what you have. That seems to make sense to most people.
How can experienced cosmetic surgeons make such terrible mistakes?
That's a very, very politically charged question. I think everybody has their expertise. The doctor that did Debbie, for instance, does nice body surgery, but I wouldn't say that nasal surgery is his specialty. Debbie didn't know that. And I think the nose is probably the most difficult operation. People come to my office and they say, they said, yeah, I'm very, very nervous about having my nose done. I said, why are you nervous? I don't want to look like everybody on the street. What they're referring to are all the bad nose jobs that look like nose jobs.
You actually had a patient who had a nose that looked like a pig after, isn't that?
That one was probably more of an accident than bad planning. A large piece of cartilage was removed from the tip of the nose, and the whole thing just rode right up like a visor on a helmet.
Oh, God. That must have been so awful for that person.
And I booked that operation without even seeing the patient in person, because she lived, you know, in North Carolina.
So she came to you to have it fixed?
Yeah, the day before, she did fly in, and I said, wow. I saw photographs. I said, well, I could probably fix it. But I told her she might have to go back on the same plane, go back to North Carolina. But I usually don't turn too many people away, and I said, I think I can help you. And I was pretty lucky. I got her.
Okay, now you helped Aaron. I got to take a break. When we come back, we're going to find out from both Dr. Lipkin and from Aaron what you looked like before, what you were unhappy with, and why you love your nose now. Wait, now, Dr. Lipkin, let's pick up the story from you, because you know, Erin comes in to see you with that nose, not the nose she's got now, because the nose you have now is the one Dr. Lipkin gave you, right? Okay. That's a very happy nose, right?
No, I said I look like a member of my family now, you know.
And tell me the reaction when you first saw her. I want to know how Erin felt when she came in. What did she express to you?
Actually, Erin was pretty level-headed. She basically had resigned herself that she was going to have to live with the sixth nose, because nobody was willing to try to fix it.
6 nose jobs? You go in there thinking you're going to look great, and you could come out there looking terrible if you pick the wrong doctor, or you can pick the right doctor who can still have an accident when doing your surgery. Isn't that true, Dr. Lipkin?
Absolutely. And there's a that's a good way to divide the, unhappy results of surgery. Kathleen's lip is an accident. That was not planned. But Erin's nose, from the beginning, all through the 6 operations, were intentional. The first doctor intended, no accident, to take the entire bridge down. That was his technique. And I agree with Erin. That's why I was very, very interested in fixing her nose, that she needed a very, a nice high bridge. Her profile originally was very, very nice. But from the front, it was unbelievable. It was very wide. She was correct. All she needed was to take that front and just narrow it. Same nose, just narrow it. It would have been a perfect nose. Instead, she ran around 360 degrees to get something that is probably not even quite what you had in mind, but close.
As I said, I look related.
Related.
I look related.
When you looked in the mirror after the bandages came off and the swelling and everything was healed, did you feel like $1 million when you saw that nose?
Oh, this?
Yeah.
I got on that car phone, cancer or not, I got on that car phone and started calling friends and saying, I got it, I got it.
And what did I tell you? Do you remember? No.
What?
What did I tell you when you were in my office with your mother? I took the bandage off and you were on the ceiling. We pulled you down from the ceiling. You were so happy.
Oh,
What did
yeah.
I tell you? You don't remember. Patients never remember.
Did you tell me don't?
This is where all the bad results come from. They don't listen. What did I tell you?
Did you say don't use the phone?
No. Only for local calls. No, I told you, listen, don't count, don't be ecstatic until 3 months goes by.
Until it heals.
So this is not simple surgery. It was extraordinary techniques to get that nose from where you started. And what did I tell you could happen?
It could have gotten infected.
Right.
It is a rib.
It's
It
coming
was a
back.
donor rib graft.
Rib cartilage?
It was
You
someone
used?
else's. It was, please donate organs. It's on my card. But, it was someone's who had been in an accident. It was a donor rib cartilage, irradiated, and so it could have rejected.
She had nothing left. You see, all the other doctors had used all the good tissue. Her septum was used for one of the 5 or 6 other operations. Both ears. There was nothing left for me to work with. I could have taken your rib cartilage, and she'd walk around for 14 years with pain every time you take a breath. So I decided to use donor cartilage.
My question is for Dr. Lipkin. Do you think the responsibility is 100% that of the doctors, or could it be the individual physiology of the patient not healing the way the doctor wanted the body to heal?
That's a very good question, actually. It's both. But you can predict healing to an extent. You have a person with very thick skin on their nose. You know they're not going to heal well. And you might have to overdo certain parts of the operation to take that into account.
Who was told that because they were a smoker they didn't heal well?
It was me.
Was that you, Karen?
Yeah.
Is that true, Dr. Lipkin? Smokers
Well,
don't?
smoking is definitely one of the big enemies of good wound healing. But on a breast reduction, I don't know if smoking
Well, I
is
can
a big-
understand if you were smoking like 20, 30 years, but like I was smoking maybe 5, 6 years.
I'll tell you-
Ollie kept telling me I was smoking.
I have to tell you, smoking...
So I want to get back to this because I think you feel like he made you responsible, Karen, for
Yeah, he
what went
did.
wrong. Am I right about that?
Yeah, he did.
If you hadn't smoked, you would have been okay.
I would have healed better.
Is that
I would have
baloney
healed better
or
if
what,
my
Dr.
skin
Lipkin?
wasn't so thick.
Well, if he felt it was such a poor risk, maybe he shouldn't have done it in the first place.
All he kept throwing in my face was I was smoking.
It does impair wound healing. And on facelifts, it definitely makes a big difference. But most people heal reasonably well, even when they smoke.
My question's for the doctor. I was just wondering, how does someone go about choosing a doctor? Do they just depend on word of mouth, or is there somewhere they could look up to see if doctors have made like these kinds of errors? Or
I was very interested in doing Erin's nose for several reasons. First of all, I really liked her. She was happy. 6 operations later, she was a happy person. But Erin went to some of the most famous nasal surgeons in the country, from the West Coast to the East Coast. The people whose books I read when I was a resident at Manhattan Eye in the 70s. And I knew that I could make her nose better. I was very interested in doing that. So she did her homework after a while. By the 3rd nose operation, she was starting to do research. So I think you have to start differentiating between surgery and revision surgery.
Well, let me just point out here as well, because that's a very important question, that, if your doctor says, your general practitioner says, go to Dr. Jones, Dr. Jones could be his buddy who he owns a favor to.
Shares a locker with at the club.
Oh, yeah, or plays golf with. We don't like to think that, but one never knows. It's a very good question, because I don't know how do you answer that, because I know that people all over the country want to know, how do I pick a good cosmetic surgeon? Because no one wants this to happen to them.
I think you have to, instead of dealing with on the professional level, I think you have to deal more on the consumer level. I think you have to really start researching patients. And that's what I do in my office. Patients walk away sometimes with phone numbers and names of 6 people, 7 people who've had similar surgeries. And that's realistic, because this is it. It's like a piano competition. You get up there, you do it, and somebody judges what you do.
And would you do plastic surgery, facial plastic surgery on someone that had keloid skin?
What's keloid skin?
Keloid is when you heal. I had surgery on my neck, and I have keloid skin, so I have a lump on the
scar tissue.
The scar tissue shows.
Depends on the operation, actually. Sometimes the chest area tends to keloid, but it's not as common on the face. I would have no hesitation about doing a nose operation or eyelid surgery. I would start being more concerned on a facelift.
Where would the scars be?
Well, we try to, if you're intent on doing your facelift, even knowing that you might keloid, which is just a bad form of scarring, we try to hide them as best as possible.
Some people scar worse than others, I would assume.
Absolutely.
Okay. People with thin skin scar worse or thicker?
Thin skin is a dream for facelift and eyelid surgery.
That's why he said I scarred more, because my skin is thicker.
All right. I want to just get back to Karen for a moment, because I keep worrying about I worry about you, Karen, because I do. I feel badly about what's happened to you. And the fact is that, is there something you can say to her, Dr. Lipkin, about she won't take her top off, she won't wear a swimsuit, and she won't even let her own boyfriend, who she loves very much for the last 3 years, see her naked?
See, I think Karen's in a very good situation, actually. She doesn't walk through the streets with something on her face that people stare at, like Kathleen or Debbie. You have a boyfriend that you've had for 3 years. And I don't know, he knows you have these scars. Maybe you shouldn't make him suffer, by not exposing yourself, because he knows you have the scars. He loves you after 3 years of putting up with your neurosis. And then, you have many, many years to think about doing something about it at your own leisure, because you have no emergency.
Can you fix the nipple in a situation like that?
Fix. I love the word fix.
Well,
Never perfect. It can be improved. All the scars she has can be improved. Though I think the key is little by little, and maybe
there's like half a nipple there.
But you can graft. You can graft tissue that will look like a nipple.
I know where it comes from.
Yes.
Yes. Do you know where it comes from? Go ahead, tell us, Dr.
The vagina.
The vagina. Yeah. Okay. I had a friend who did it. That's how come I knew. Go ahead.
Yes, I have a question for Dr. Lipkin. Have you had any experience with people who had failed breast implant surgery?
Breast implant, I don't do breast implants and never did, but the complication rate is about 50% in terms of all people that have unsuccessful results. That means anything from disasters to just hard implants. And despite a 50% complication rate, various types of complications, it was the most popular operation in the United States for the last 30 years. So people want this operation. But
you're a lawyer, I understand, right?
Yes, I have about 15 cases. I'm acting for a number of women who had failed breast implant surgery. Most of the implants have come out.
It was always an imperfect operation. The body's reaction to the implant was always unpredictable. And obviously enough research probably hadn't gone into the effects of silicone. And I think
you're so incredibly open and honest about it, but I'll tell you, I've had plastic surgeons on the show who will tell me, straight to my face that this operation is safe and all of this is a tempest in a teapot and so on and so on. And they're very angry that they can't use silicone anymore. It's refreshing to hear that you have that.
I guess I'm so honest about it because I don't do it. The fact that they took breast implants off the market did not affect my practice one bit. It was sort of like, I told you so.
Oh, they want me to say goodbye. So I do want to say goodbye.